Good morning. I'm just coming here today because I'm starting a new Instagram and possibly a YouTube channel because I've been doing a lot of research on post traumatic stress syndrome in women after they have children, after childbirth. And I have been thinking for a while about starting an Instagram or even a YouTube just to talk about doula stuff, childbirth stuff, because I'm really passionate about that. But after I read the study, I kept thinking it's not just about teaching women how to have the birth they want, but it's to actually help them realize how important it is to be an advocate for themselves, to have a good support system that can be part of their birth by helping them achieve their goals, especially during the time that they're right in the middle of delivering, because that's not the time that you should be trying to stand up for yourself. So I read this study that said a third of women in the study had post traumatic stress syndrome after childbirth, but not for the reasons you might think. It wasn't because it was a traumatic birth. It wasn't because it was a difficult birth or a long birth or actually anything to do with her physically giving birth. It had to do with how they were treated by their provider. So, the four reasons that the study shows that women have post traumatic stress syndrome after they gave birth is number one, the provider putting their agenda first. So, trying to manage the birth to suit his or her needs, their needs, and trying to just do whatever it takes to make the provider's life a lot easier without any consideration um, to the birthing person. Um, the next one is called, or the next reason, and I have notes here because I want to make sure I get it right, is disregarding embodied knowledge. A woman knows her body, but sometimes her own feelings about her birth and her baby are dismissed in favor of what a professional thinks is happening. One thing that I learned as a doula is that you trust the person that's given birth. They know their body. Their It has been proven by other studies that a woman's instinct about her medical health is more correct than what a provider thinks is wrong with them. So always listen to your instinct, um, and then have a provider that takes you seriously. The next thing is lies and threats. In some cases, women are pressured into happens all the time. Pressured into procedures through fear, with providers using lies or threats about the baby's safety to get them to comply. I have seen this myself, where a provider comes in, the birth is not going as quickly as this provider wants, and so they make the parents or the couple, the partnership, feel like they need to hurry up because the provider is just too busy. He's got other patients. One provider actually said they were covering 3 hospitals. So after the provider left, I told my client, that's not your problem. Well, he shouldn't have gotten himself into that situation. But that's what I mean. They're trying to force the situation by making you feel guilty that they're too busy. Well, who cares, right? And then finally, violation. And this is the most distressing part. Some women describe experiences that feel abusive or even violent, which can trigger memories of past trauma. I've seen that too. I've seen where providers just treat the body like there's not a person in, like an actual individual in that body that has autonomy and feelings. Just the things that I've seen. The very last birth, I'm not going to go into, but that's actually the last birth that I did because I was traumatized by watching how they were treating um, the birthing person. But anyway, I really think that we need to be out there teaching the, especially the younger generation that is coming up, who are in their reproductive years, that they that their pregnancy and their birth is a sacred time for them, and they shouldn't be treated the way a lot of 1/3 of birthing people are treated, so badly that they get post-traumatic stress syndrome. And that's one reason that I wanted to try to get this, either Instagram or YouTube. I haven't, maybe both. I haven't actually decided what would be the best way for me to um, get this information out. But I really would like you guys to join me, and I will remember to put the link wherever I post this. So I might do it YouTube, I might do an Instagram video. I'm still learning Instagram videos, but for sure I do have a YouTube that I might use for this. So again, if you know somebody who's pregnant, somebody who is about to give birth, and they don't understand the importance of their education toward childbirth and their rights, and their understanding that it's their birth, their pregnancy, their child, all of this is important, to find a provider that's going to listen to you, and not just listen to you and nod and say yes, yes. And because there's so many providers that do that, they just nod, sure, yeah, we'll do that, and then when it comes to the actual labor and delivery, all that goes out the window, because they really don't care. You got to find a provider that cares and will stick with you and with your wants. Granted, there are situations when there's an emergency that you might have to listen and not have the planned birth that you wanted. But if you're having a regular, low risk, which is most births, low risk pregnancy and delivery, then you should be able to stand up for the things that you want. And also remember, which is something we're going to talk about, is that a lot of these emergencies that happen during labor are really caused not by something wrong with you, but by the interventions. That's really something that is important for people to know. So hopefully I can get this out, and hopefully I can keep with it, because consistency is not my friend. But this is really important. It's really important to me, and it's really important to everyone who ever is pregnant or will have a baby. So wish me luck. Thanks.